Welcome, everyone. Thank you for joining us for today's webinar. My name is Jefferson, and I'm the marketing manager here at Hampton Roads Community Health Center, where we care so you can be healthy. Hampton Roads Community Health Center is a leading nonprofit provider of healthcare services to the medically underserved and disadvantaged population in Hampton Roads, Virginia. Today, I am joined by various panelists as we discuss the value of community health centers. It is of utmost importance that we bring light to the myriad of services and programs that community health centers across our nation provide. These services play a vital role in the overall health and well-being of the people we serve. Each of today's panelists adds value to the services and programs that we provide to the community. So we wanted to hear directly from them on why they chose a career at Hampton Roads Community Health Center. Our panelists include Mrs. Barbara Willis, CEO of Hampton Roads Community Health Center, Rick Shinn, Director of Government Affairs for Virginia Community Healthcare Association, Erica Johnson, Chief Compliance Officer and Interim Chief Operating Officer, Phyllis Spellman, Clinical Coordinator, Brandon Thomas, Quality Compliance Coordinator, Nina Cornelius, 340B Advanced Certified Expert and Regulatory Compliance Coordinator, Dr. Benjamin Steele, Director of Dental, Sarah Rogers, Director of Nursing, Shawn Brown, Lead Referrals Coordinator, Arlo Harris, Referrals Coordinator, Michel, Bile, Chief Financial Officer, Maureen Troublefield, Director of Financial Services, Brenda Sanderson, Call Center Representative, Jeanette Collins, Director of Human Resources, Shaquita Mason, HR Associate, Greg Burns, Accountant, and Rhonda Hernandez, Decision Support Analyst. Now, without further ado, I would like to introduce our first panelist, Barbara Willis. Mrs. Willis is the CEO of Hampton Roads Community Health Center and presents over 35 years of experience, which includes both public and private sector. Under her leadership, Hampton Roads Community Health Center has expanded from a $4.3 million budget in 2003 to over $10 million budget to date.
First, hats off to you, Latrice, and the Hampton Roads team. You guys are doing a fantastic job of being able to share with the world what we are able to do through Hampton Roads Community Health Center. And that leads to why I love Hampton Roads Community Health Center, is because we are servant leaders. So what do I mean by that we are servant leaders? It means that, one, the individuals who work at the health center have a heart for the patients. Not only do they have a heart for patients, many times I find out that outside of their work environment, they have a heart for their family and they have a heart for their community in how they are able to serve and provide for so many different folks. And for that, I say thank you very much. Hampton Roads Community Health Center, we're celebrating 25 years of existence. And with those 25 years, we've been able to touch the lives of many people in the South Hampton Roads community. And so we are here because, one, we want to be here, and two, because there's a calling for us to fulfill. And so as a result of that, we are able to deliver quality care in an effective manner and provide for anyone, regardless of whether or not they have the ability to pay. And with that, we are also able to serve those who can pay. Because why are we able to do that? Because of the high quality of credentialed providers that serve our patients each and every day. And so with this strong team that we have here at Hampton Roads Community Health Center, we're able to do amazing things. Now, without further ado, I would like to introduce to you Rick Shinn. Rick Shinn is the governmental affairs leader for our association for the entire state of the Commonwealth of Virginia. And Rick knows firsthand about how community health centers play a key part in the delivery of healthcare services for all Virginians. And so with that, I turn this over to Rick Shinn. Welcome, Rick.
Thank you, Mrs. Willis. I do appreciate the opportunity to participate. And I have to tell you, you've touched my heart and my soul. To hear the stories from your people and what you're doing to help the people at Hampton Roads is amazing. You are one of the pearls of community health centers that we have in our state. Just like Hampton Roads, we have 150 sites serving over 350,000 Virginians, all the way from Chincoteague on the Eastern Shore down, clear down through the coal fields of Southwest Virginia. Without the dedication and the knowledge and experience and the wisdom of people like you, we would have hundreds of thousands of people who would not have access to health care. And that's how community health centers got started, because a community of leaders in this state decided they needed help for their people, and they brought community health centers into Virginia. And from one small health center in the middle of Virginia, it's expanded out to serve hundreds, thousands of people. To hear the stories of how you're helping people health-wise, to save their lives, to improve their health, to help them reduce the cost when they don't have the funds and the money to purchase things like medications or to go see a doctor, is truly awesome. So I just want to thank you and your whole team. I'm so happy this was broadcast today and that I was able to be a part of this. So thank you for your work and for your advocacy. I'd be remiss if I didn't mention advocacy, because that's how community health centers have survived the last 50 years in the United States. It's because of people like you who let your elected officials know and the people in your community know how important you are and what you truly do and how you change lives and you change communities. So I thank you.
Those words of encouragement, it means a lot to each of us to have you here and to hear your thoughts on the services that we provide and how we can, help to improve the value and show forth the value of community health centers, not only in the Commonwealth of Virginia, but across the nation. So for those of you that are just joining us, you are tuned in to a discussion on the value of community health centers. It's hosted by Hampton Roads Community Health Center. And if you're watching us via Facebook Live, we encourage you to like this live and share it with your timeline, with your news feed, share it with your family and friends, because the value of what community health centers provide is indescribable. And so that's what we'll be discussing today. And we have some expert level panelists that will be sharing their views and their story on how and why community health centers have such a great value. As we overcome the hurdle or the challenge of technological glitches, we will call upon Dr. Steele to share his testament, if you will, to why he loves Hampton Roads Community Health Center. Dr. Steele, can you hear us?
Okay, you can hear me now? Okay.
Yes.
Okay, great. All right. So good morning. And once again, I'm Dr. Steele, Ben Steele. I'm the dental director here at Hampton Roads Community Health Center. The reason why I love Hampton Roads Community Health Center, and I think, everyone's going to pretty much say this, is because of our wonderful patients. We really value, our patients. And as a dentist, it gives me the opportunity, to educate patients about their overall oral health, to give them the opportunity to improve their smile, to improve any areas that might be giving them any trouble, and then just provide them with a place, an environment, a welcoming environment. As was indicated, one of the big obstacles of gaining one of the biggest obstacles for certain people in certain socioeconomic groups and demographic groups is access to healthcare. And I really feel as though Hampton Roads Community Health Center is that vehicle there that we can reach out to our community and provide quality healthcare. So that's why I love Hampton Roads Community Health Center.
Well, that is a very heartfelt message, and it rings true throughout our organization. And so we're really excited, even though we're having the technological issues. This is our first webinar that we've done on a mass level that we're putting out to the general public. So let's talk about compliance. Compliance is a dirty word with very clean outcomes. And here to share a little bit about what compliance does at HRCHC is none other than the Chief Compliance Officer, Erica Johnson.
Hello. Thank you, Latrice, for putting this together. And yes, the compliance team does do a lot to keep the organization clean in terms of policies and procedures. With our accreditation agencies, the compliance team works diligently with policies and protocols to ensure that all of our practices, our quality metrics, everything is in line and in tune with the expectations. We set goals, we measure our goals, we implement practices to improve. We are constantly working to measure our performance to ensure that we are delivering the best care possible, in addition to providing a safe environment and ensuring that all of the departments are working collectively to implement what we need to provide in the environment of care for our organization. So yeah, compliance is really busy, and we are very fortunate to be a part of the Community Health Center. And one of what I love about Hampton Roads Community Health Center, I'll do my time now, is access, which is really important. And the Community Health Center is a staple when it comes to accessibility for individuals in the community who do not have routine access to quality health care. So that is important. And in terms of compliance and being able to support that notion that we remain accessible to individuals, it's an honor to be part of such an organization. So thank you.
Thank you. Thank you for your service and for your determined leadership to ensure that we are compliant and that we do everything the way it should be done so that we can continue to provide high quality health care. So Erica leads a very robust team of professionals up to and including compliance coordinators and clinical coordinators. So let's hear from them. Next up, we have Phyllis Spellman.
Hello, how are you?
I am doing well. Thank you so much for joining us today. Tell us a little bit about why you have chosen to serve at HRCHC and what it means to you.
Well, healthcare in general is my heart and my passion. I really like HRCHC because we strive to always push forward and go to the highest quality that we can. So it's really a no-brainer when it comes to working in healthcare at HRCHC because HRCHC represents quality healthcare.
Absolutely. Thank you so much for that. Let's hear from Brandon Thomas, Quality Compliance Coordinator.
Hi, good morning. Yeah, I think our task here is extremely important, making sure that patients get high quality healthcare. I think it's something that as a safety net organization that we like to reiterate and focus on. So not just giving patients access to services as a safety net, but we also like to focus on making sure that it's the highest quality service, and that's something that we pride ourselves on, and we work tirelessly to gather as much data and make as many changes, especially on the quality side, to make sure that patients are proud about where they receive their health care.
Thank you so much, Brandon. And I know that you also work with the 340B program alongside Nina. So we're going to get Nina to talk to us a little bit about 340B and how she sees that program as being a catalyst for assisting our patients.
Hi, everybody. So as you stated, my name is Gina, and I am the Regulatory Compliance Coordinator here with Hampton Roads. We have a medication discount program that we call 340B. With 340B, our patients are able to access medications at a reduced rate, generally 50 to 70% cheaper than they would if they would just go walk into a pharmacy and fill a prescription. So we found that that has been an extreme benefit to our patients, helping them continue with their continuity of care, staying on task, and the main thing is being compliant. We find that offering this program, we don't have as many individuals who come in or have to go to the hospital because they can access what they need by their primary care.
Absolutely. And Nina, just I know that you've recently expanded the number of pharmacies that we're working with. What is that number looking like right now?
We are approximately 45 pharmacies as of July 1. We will be adding 15 CVS pharmacies to our network, so our patients will be able to utilize those as well. So currently, we have 18 contracted Walgreens pharmacies, we have Walmart pharmacies, we have 3 independent pharmacies, Hague, Bayview, and People's Pharmacy, and again, we're gonna be bringing on 15 additional pharmacies, including specialty with CVS.
That is amazing. So this is amazing work. Thank you so much for your due diligence in making sure that our patients have access to affordable prescription drugs. I would hate to move forward without talking about the human relations component of what we do here at HRCHC. The value of having a team that is dedicated to recruiting professional, high quality staff is an art, I believe. So to talk to us a little bit about how that process affects the organization is our Director of Human Resources, Jeanette Collins. Mrs. Collins, do you have a sign to tell us why you love HRCHC?
So, hi, Latrice. Hey, everybody. So my sign says, we stand in the gap. I love HRCHC because we stand in the gap and we help those thousands improve their lives. And so as the Human Resources Director at HRCHC, I have the honor of representing employees and the organization, but essentially my job is to make sure that we get the very best talent that is available to help assist our many, many patients. And I have to say that it has been a pleasure working here with so many awesome employees. We strive every day to make sure that the lives of our employees are enriched, because when our employees' lives are enriched, then they can better help our thousands of patients. So that is my role here at HRCHC.
Amazing. And what I can say is that we have seen tremendous improvement in how we engage and recruit our staff under the direction of Mrs. Collins. And we're very excited to have her on board, as well as Ms. Shaquita Mason, who is an HR associate. Hi, Shaquita. So Shaquita, did you have anything you wanted to share with us about why you love HRCHC?
Okay, sure. I love Hampton Roads Community Health Center because I feel that we improve the lives of patients, staff, as well as our community. As a new hire myself, I brought my personal abilities with me, but the staff here has helped develop my interpersonal skills, and that has allowed me to positively and effectively communicate. The HR world is ever changing, and although we don't have a real visual relationship with the patients, the employees have kept me on my toes, and the new hires here have brought a new meaning of meeting new people to the forefront.
And yes, you guys have been doing some very innovative things, most recently with your drop and grab initiative, which was very well received at all of our locations. And so I've had staff to come and ask, are you guys doing that again? Is HR going to do something like that again? And I said, you know, you never know what they have up their sleeve. They're always working on engaging the staff and just making everyone feel welcome and are part of our Community Health Center family. So thank you both for the work that you do. We are so happy to have you here. All right, so as we move forward, let's talk about those frontliners, right? So knowing that we're in healthcare, we're all considered frontline staff. However, there are some of us that are truly on the front lines, and with the patient engagement and, you know, that face-to-face with potential hazards and things of that nature. And we know that serving on the front line, especially during a global pandemic, is not for the faint of heart. However, our next panelist leads by example as the Director of Nursing, and she does so with genuine care and concern for not only the patients, but the staff also. So let's give a round of applause to our Director of Nursing, who is actually out in the field as we speak. Hi, Sarah. You can, you're already unmuted.
Hi.
Perfect.
My passion for nursing comes from being able to help people who may be less fortunate, right? And just being able to be the staple in the community here at Hampton Roads Community Health Center and bridging the gap for patients who may otherwise fall through that gap.
Right.
We do it very well. We offer a high quality of care. All the physicians, nurses, and medical assistants that we have here are great, and they work to the top and above their scope of practice. So just being able to do that and bring that to the table every day is just awesome. And I thank you all for the opportunity.
Well, we thank you for your leadership. I know that it has to be difficult to have such an array of things happening simultaneously, and with the climate and the way things have changed and the pandemic has changed the trajectory of healthcare, you have truly led with excellence, and so we appreciate your hard work and your due diligence.
Thank you. It has not been very challenging because we just have a great clinical team. From our chief medical officer to our chief compliance officer, who is also a registered nurse, right?
Right.
Human resources has been very great in being able to bring on and onboard qualified, very qualified, highly qualified individuals. So, and then under me, there's a great team that serves, and they just make my job so much more easier. So I just thank them for what they bring to the table as well.
Awesome. Well, as we segue into one of the departments that serves under Sarah Rogers, who's the Director of Nursing, we talk about referrals and how we save the lives of people. So I want to share a testimonial that came in through one of our patients. And of course, due to HIPAA compliance, we are only providing the first name of the patient. The patient shares, through the high quality comprehensive care I received as a patient at HRCHC's Park Place Family Medical Center, I was diagnosed with and received treatment for breast cancer. Dr. Markovic was prompt in referring me to the Every Woman's Life program, where I received a series of diagnostic mammograms that confirmed that I had left breast cancer. I didn't have to worry about costs or how I was going to get the treatment. Because of HRCHC's comprehensive healthcare services and referral, I received life-saving surgeries and much-needed treatment. I'm alive today because of Hampton Roads Community Health Center. So that is one of the tremendous testimonies that we have, and we're very excited to be able to play this role in the lives of our patients. So as this particular testimonial relates to our referrals team and their ability to promptly refer a patient out for much needed care, let's bring on our lead referrals coordinator, Shawn Brown.
Hi, everybody. Can you hear me? Hi. Hey, I've got my sign, and the reason I love HRCHC is because it gives me the opportunity to make a difference. And I also love it because of the camaraderie among the coworkers. And I believe that HRCHC has the positive impact on the lives of our staff and patients because we are blessed with the ability and opportunity to make a difference. okay, in so many people's lives by helping to improve their quality of health care. Without HRCHC, many members of our community and surrounding communities would be without vital healthcare services and resources. And as a referral coordinator, I am able to assist patients when there's a need for specialty care or testing and to ensure they are getting the proper health care needed to improve their quality of life. I believe that the camaraderie among us here at HRCHC helps to create a better atmosphere and work environment for everyone, which in turn helps HRCHC in providing the best care possible to our patients.
Shawn, you're trying to make us cry today, and that's not going to work. We really appreciate just the heartfelt way in which the referrals team does their work. I've seen you work together as a well-oiled machine to ensure that patients who are referred out, that they get the care in a timely fashion. I think a lot of times people don't understand, you know, if we did not have that referrals team, the ability for patients to receive timely care would not exist. And so we appreciate you for everything that you do. Let's talk to Arlo. Arlo, are you here with us?
I'm here.
So Arlo is another referrals coordinator. Hi, there you are. He's social distancing in his cubicle, and we want to make sure that everyone can see and hear him. So Arlo, do you have a sign for us today?
I do.
Awesome. What does that sign say? Oh my gosh.
The sign says, I love Hampton Roads Community Health Center because it's actually the pillar of the community. It's very well dependent upon, it's very well the connection between the community and having access to high quality health care.
So that is great. Yes, we are a pillar in the community. And one of the things that sets HRCHC apart from other providers or other organizations is that we collectively, we work 24/7 every day. Our mission is to show people that we care so they can be healthy. And that plays a role in us coming together from all areas and making the necessary adjustments and doing what we need to do so that we can continue to provide that high quality comprehensive care so that we can maintain health and wellness for all of our patients. So we truly thank the referrals team for everything that they do. They play a great part in the success of our patient care. For those of you that have just joined us, you are tuned in to a discussion on the value of community health centers. Let's talk about money. I know money is always a difficult discussion, so we are blessed to have Mr. Michel, Bile, our Chief Financial Officer, at the helm of keeping our finances in line and making sure that we do not spend too much. And so it's awesome to have him and some of his team members here with us today. Let's tell you just a little bit about Mr. Bile. I know he is very shy when it comes to talking about himself, but in 2018, the Virginia Society of CPAs honored him with the Virginia CFO of the Year Award. And this was for large nonprofit organization category. Yay! Yes, because he gets it done, right? And this was for his leadership and record financial growth from a deficit of nearly $500,000 to running surpluses for 3+ consecutive years. So again, hats off to Mr. Bile. We appreciate you for your due diligence and your hard work to ensure that we remain fiscally stable and sound. So let's hear a little bit about you, Mr. Bile, and what makes you love Hampton Roads Community Health Center.
Thank you. Thank you very much, Ms. Latrice. I have my sign here that says, we help patients meet financial obligations. And somebody will ask, what does that mean? Simply put, in layman terms, we make sure the quality health care that our patients are receiving in the health center is affordable to them. And it all begins with the budget and projections when it comes to the number of patients and the different mix of patients that we do see. Yeah. And let me put one word in. We can always use more cash. And we can always use more cash. And I say that because even in recent times when we receive some money from our HRCHC for testing, we are beginning to realize that we should have probably gotten a lot more money to help with more testing. So this is very, very important. You know, we budgeted for a 10-month period around 520 tests, and we did almost 200 in 1 week. So just looking at the numbers, we're going to need some more cash to do some more testing. So we take all these patients into account, the uninsured, you have the underinsured, and often they are caught in between what people refer to as a rock and a hard place. They don't make enough to be able to qualify for the health insurance, but yet they don't, it's too small, you know, it's not too small that they cannot be qualified for the sliding fee in terms of being a slide A. So we do put all this in the projections to ensure that a lot of these patients are accounted for, and at the same time making sure that we can be financially stable and sound. But as always, we can always use more cash. Thank you, Latrice.
Thank you so much, Mr. Bile, and you're absolutely right. You know, with the influx of patients and the impact that COVID-19 has had on, you know, patients with pre-existing conditions, as well as patients that may have had underlying conditions unbeknownst to them. So the need for additional funding is always present. And so we are grateful again to have someone like you leading the way to help us to manage those funds properly and to ensure that we are meeting our benchmarks from a financial perspective. Serving under Mr. Bile, we have Maureen Troublefield here. And Maureen, I call her the guru of billing because she makes sure that the carriers are right, everybody's up to speed, everybody's up to par, and she's really good about communicating any changes or modifications. So let's hear from Maureen. Maureen, tell us a little bit about why you love HRCHC.
Thanks, Latrice. It gives me, I have the privilege of talking with patients when it comes to the financial aspect of their care. And what is amazing for HRCHC is that we try to work out process to help those who are not able to take care of their bills in a financial way. We have different stages of looking at what their issues are and being able to either adjust their charges or even out to waive those charges. And one of the privileges that I find working is to hear a patient being able to say thank you for helping them, not just in the health aspect of it, but also the financial aspect of it. I have a brilliant group of staff that also works in our front desk representatives who are our first run, in a way I call them our first defense in seeing these patients. So the joy of working at HRCHC is to be able not only to handle the healthy part of the patient, but also the financial part of it, so that they won't have that pressure to worry about when it comes to their health.
Absolutely, and that's a much needed service. Not to segue too hard, but we have a testimony that is directly correlative to your service as a finance director. It's from Robert. He says, I'm self-employed, so I opted to self-pay at HRCHC. Their discount fee sliding scale saves me and my family thousands of dollars a year. My son plays sports at school, but he is also an asthmatic. His inhalers could cost hundreds of dollars per month. So I enrolled in HRCHC's 340B program. This program saves us over 50% on prescription medications. If I had to pay full price for doctor's visits and prescriptions, I wouldn't be able to feed myself or my family. And so those are some of the testimonies that we look at as adding value to what we do and why we do it. So thank you so much, Ms. Maureen, for leading that team to ensure that the patients have what they need in the way of services without the concern of whether or not they can pay for it or if they'll be seen regardless.
Good morning. I love Hampton Roads Community Health Center because as a front desk associate, I can assist with helping patients remain and become healthy.
That is awesome, and that is so accurate. What you do being on the front lines and the engagement of patient interaction is very vital to the success of our organization, especially having 5 locations within our region. So we truly appreciate you for that, Kenneth. Have a special group of individuals. So everyone that serves at HRCHC is special. That's undeniable. But there's a certain group that is really on the front line from a non-clinical perspective. And so with that, those individuals, they receive the calls. Thousands and thousands of calls per month that come into the call center. They are asking questions about how can I make an appointment? How can I get tested for COVID? They have infinite questions, and these individuals are highly trained to provide answers to those questions and lead these patients in the right direction so that they can make appointments, whether it's in office or televisit. And I'm in awe of what they do because it's a lot of information and it's ever changing, especially during this pandemic. So with that being said, I introduce Brenda Sanderson, who is one of our call center representatives. Brenda, are you here with us?
I am. Good morning.
Hi. So we have Brenda is social distancing in one of our meeting rooms, and she's going to tell us why she loves HRCHC.
Well, I love HRCHC because what we do does make a difference. Although we are in the call center, we are one of the first points of contact for the patients. So in addition to registering them and educating them on policies and things that do change on a daily basis, facility, also get them scheduled for their appointments, and we help with their medications, which they keep on a daily.
Amazing. And I've witnessed firsthand, they get calls of all sorts, questions that the average person would not have had the answer to, but they're able to boom, 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 answer the question, get the patient scheduled, and lead them in the right direction. And so we appreciate Brenda as well as the other call center representatives for taking on such a massive undertaking. Your efforts are not unnoted. So let's talk a little bit more about money. We have, again, under the leadership of our Chief Financial Officer, we have individuals that specialize in finance. And so that, to me, makes my head hurt, but it is absolutely necessary. So let's hear from our accountant, Mr. Greg Burns. Hi, Greg.
Hi, thank you. I thought you were gonna forget about me. But I made a sign, I put every patient count. But the real thing about Hampton Roads Community Health Center is before coming here and being employed here, I was not aware of community health centers. And it was shocking to me that I didn't know that this existed and how valuable this is to the community to serve all the people that cannot afford health insurance. And it's really mind-boggling that it's not out there and that everyone knows about these community health centers and the quality of care they can get when if they do not have money or cannot afford to get health care. And that's just something that's really stuck with me here, knowing that these exist. Also, the team that works here, everyone, that's the biggest thing about this job. We all do individual jobs here. I couldn't tell you exactly what every person does, but we all do it well, and we're all in it together. And I think, as Ms. Will said earlier, that we definitely care, and you can just tell by our interactions as employees, as we talk to each other passing by, or just talking, not even about work, but you can tell that each person here actually does care. And that's huge, where you spend most of your life at work and doing something that actually matters and counts.
Such a great message and statement. Again, as we said at the top of the hour, our mission drives everything that we do. And that mission is, we care so that you can be healthy. We want everyone to have a level of health and well-being throughout our community. We believe that everyone deserves quality health care, and that is why we are here, and that is why we serve. So closing out our panel for today is, I call her the Excel expert, because she runs the numbers that give us the knowledge of how we need to make adjustments to how we're serving the patients, whether it's patient panels or number of how many patients we're serving that's homeless versus insured versus uninsured. This person is the numbers cruncher. She pulls the numbers together and makes them legible for us to digest. So let's bring aboard our decision support analyst, who also serves under our Chief Financial Officer. Hi, Rhonda.
Hello, hello.
Hello.
So my sign says that I love HRCHC because we all work together. And each of us have our own individual set of skills and expertise. And the thing I like about this place is we all get a chance to shine, and we all get a chance to use those skills to meet one specific goal. My job here is about as behind the scenes as you can get. I don't, I'm not on the front line with patients, but I'm there pulling all the information that we have into, reports and other, data type programs, so that we can make informed decisions. We can know what our patient population is doing, but also what they need. And we can look forward to planning and, where to put our time and money to get the best outcomes.
So we thank you so much, Rhonda, for sharing with us why you love HRCHC. The service that you provide here is very valuable, and you do it well. So we thank you. So we're closing out, but I wanted to present my sign. So my sign says, I love Hampton Roads Community Health Center because they serve with genuine care and provide hope to members of our community. We are what I would call hope dealers. We give people who come in, their health is poor, they may not have the finances that they believe are necessary to receive high quality comprehensive health care. However, we provide them with the tools and the resources to get the quality care that they deserve. We appreciate everything that HRCHC does and the value that they add to the community. As we close, I would like to ask Mrs. Willis if she has any final remarks for us.
Thank you, Latrice. Again, thank each and every one of the participants on this Facebook Live. Job certainly well done. And I think it's also, I appreciate the fact that you took the time to talk to those individuals that are not necessarily on the front line, although we need our providers dearly. And we thank you, Dr. Steele, for the work that you and your team are doing, because as we go through this pandemic crisis, we know that as they're doing work in the hospitals and the emergency room, the dental part of it, the oral health part of it is very much exposed. And so we hope that we are able to do all that we can for your safety and well-being, and for the safety and well-being of the patients who are entrusting themselves to come to our center. I just hope that people will begin to really understand the value of having access to care conveniently placed in typically underserved communities, and that these communities are not being served by individuals of little or no credentials, but instead these are individuals who have chosen to use their high skills and expertise to provide this much needed service for them in convenient locations. And so thank you once again for hosting this. And we look forward to those who may not have a primary care home to look to Hampton Roads Community Health Center and the other community health centers located throughout the Commonwealth of Virginia as a good place to come to receive the best care possible. Thank you.
Thank you so much, Mrs. Willis. Well, as we conclude the discussion on the value of community health centers, we would like to thank you, Mrs. Willis and Rick Shinn, and each of our panelists for your participation. More importantly, we thank you for tuning in. We encourage each of you to stay connected with us through our website or any of our social media platforms as shown on the screen. Feel free to inbox us on Facebook or email us at info@hrchc.org. Thank you so much. Thank you so much for being here. We'll see you guys next time. Bye-bye.
Bye-bye.